Hey everyone, thanks for jumping on. I'm Ben Checkero, the Chief Brand Officer here at StemWave, and every couple weeks we do these live Q&As with one of our amazing providers to give you a behind-the-scenes look at how they're using StemWave in their clinic, what kind of results they're seeing, and what the journey looked like when they first got started. And I know a lot of you are here because you're curious, maybe even a little bit on the fence, and that's exactly what this is for. Just a real talk with real providers, and hopefully this helps answer some of your questions and gives you a clearer picture of what's possible with StemWave. So, without further ado, let's get into it. And today, I'm really excited to be joined by Dr. Lauren McCabe, who has a clinic in Naples, Florida. So, Dr. McCabe, welcome.
Thank you.
So I always like to give people a background. We have all different types of providers that watch these Q&As. We have chiropractors, MDs, physical therapists, all sorts of medical professionals. It's always great to get an idea of like your background, and maybe it aligns with someone else and they can see themselves in your journey. So tell us a little bit about who you are and like where you came from and how you got started.
Okay. So I'm Dr. Lauren McCabe. I am a sports chiropractor and I do have a sports diplomate. So does my husband. We practice together here in Naples. Um, I've been in practice for about 20 years. We started in practice in Portland, Oregon. We practiced out there for 15 years and then moved to Florida in 2021 and launched our clinic basically from scratch down here since then. Um, Prior to going to chiropractic school, I worked in clinical research at the University of Chicago hospitals. So I am kind of a science-minded, evidence-based kind of person. I like to do a lot of research and
Love that. We love that.
yeah,
Yeah.
yeah, I like to be kind of always looking at kind of what's new and how we can better serve our patients to achieve a really high level of performance outcome.
Nice. Wow. So from Oregon to Florida. Nice.
Yes,
Smart.
yeah. Chicago to Oregon to Florida.
It's
I
true.
mean,
It's true. I myself went from Washington State now to Boston, so another East Coast travel. But yeah, I think Florida, that's a nice upgrade for you weather-wise.
for sure.
Yeah. So when you first started out, you said you kind of started your clinic from scratch. What were some of the typical cases that you see come through the door?
Well, we are in Florida, so we do tend to see kind of an older population than we were seeing when we were in Portland and just kind of different demographic in that regard. But we are in Naples, which is it was on Jeopardy. We are the pickleball capital of the world. So we have a lot of really active people. You know, they are older, but they want to be able to enjoy their snowbird season down here. We see a lot of golfers, we see a lot of pickleball players, and we do see our kids are 15, almost 13, and almost 11. So we see a lot of youth athletes as well. Um, and so that's kind of our kind of two niche groups that we see. It's like the older active people and then the youth athletes who've been injured in their sports.
Wow,
Kind of
I mean,
have.
it must be a revolving door with all the pickleball injuries these days.
Oh my goodness. Yes, it's
I
been
had
great.
one. I got one, and I was able to use StemWave on mine to heal it. Um,
Mhm.
so it seems like you were doing mostly manual therapies.
Yes, we do a lot of manual therapies. We are as sports chiropractors, we treat a lot of extremity issues, and we built a reputation for uh, our hands-on work. We do still do a lot of taping. We had a class 4 laser that we were using, but we were still finding um, that there were things that we weren't getting the results that we really wanted. So that's when we started investigating what else was out there, trying to prevent people from having to have injections or surgeries or things like that that they didn't want, that were going to take them out of their sport.
Yeah. And besides the laser, was there any other non-manual modalities that you guys adopted early on?
Not really. We had kind of moved away. We did do, the stim and the ultrasound and those kinds of things. But uh, they just were so temporary. And Florida reimbursement for insurance is extremely low. So it really wasn't worth our time to be utilizing those interventions. So we did move away from those pretty quickly. Um, so it was
Yeah.
mostly manual therapies and laser when we needed it.
Okay. Yeah, I was kind of curious to see if you had dipped your toe into anything else, and it sounds like you did try a bunch of different things, and maybe it wasn't worth like the bang for the buck. Maybe like the
Right.
results really weren't worth what you were having to go through with insurance companies and things like that.
Mhm.
So you mentioned that you started investigating other ways to help your patients. So walk us through the process of stumbling upon StemWave, and like you mentioned before, you're a research based provider, so I'm sure you looked into what this therapy was capable of.
Yes, absolutely. I personally have kind of stayed connected with a lot of other chiropractors in other states and uh, just asking questions. And uh, we did have some friends who were using a couple of different shockwave devices. And so we actually demoed kind of multiple ones. And we found when we were researching that we wanted one that had a pretty good depth of penetration. And then we started looking at the costs of these devices and what the overhead was going to look like. And that was kind of how we kind of narrowed our focus to the StemWave device.
And so was it something where like you saw an ad, or did you just like go out researching on your own and kind of organically find StemWave?
Uh, I didn't see an ad. It was more through word of mouth for me. We had some friends who were using it in Portland. We had friends who were using some of the other devices that we've talked to, more of the radial devices. We looked into one of those, and the people who had the StemWave device really were very pleased with it. So then we demoed that device and obviously have stayed with it.
Nice. I mean, that's the best marketing of all. You actually like
Yeah.
talk to people that were StemWave providers and they
Mhm.
shared their experience and showed it to you. Now, what was it like something that you were sold just from the recommendation, or did you go look at some of the data?
Uh, Both.
What did what
The
did you
people
what
that
did you
we,
start discovering when you started looking into what was out there informationally?
um, well, I really was going to the primary research and then looking at what sort of clinical results people were having with um, how many, how many treatments people needed, the kind of those protocols, and that combination from looking at the primary research that was coming out of Israel and Europe and other places, the the device seemed to better fit um, to be able to actually back up the claims that the device salespeople were making.
Yeah, yeah, and I'm constantly amazed. Our medical director here, Dr. Alan Madison, he's like you. He's big into research and clinical data and all that kind of stuff, and he's constantly showing all of this research about the efficacy of this type of therapy. And it seems like new stuff's coming out all the time, and I can only imagine for somebody who's never really heard of this before and they start researching, it probably sounds like this miracle, amazing modality. When
Right.
you started talking to our team, what was that whole process like for you?
Um, so when I told the salesperson that I was working with that we were sports diplomats, they said, "Oh, Dr. Madison is too." So he took time out of his day on a weekend between his kids' soccer games, and we talked on the phone for probably an hour, just kind of going through, what his practice is like, what mine is like, kind of, and we're very, very similar. So really, Dr. Manison probably sold me on it
Oh, see,
more
I
than
didn't even
anything.
know that you had talked to him, and I was just throwing his name out because it
Yeah,
sounded
no,
like
we
you guys
did.
were similar. That's great. Yeah, he's like a wealth of knowledge about
hmm
this therapy, stem wave, just how it affects the body, all that kind of stuff. So that's fantastic. So you talked to him, and then you felt pretty solid about moving forward in the process.
Yes.
And then for people that don't know, when you become a StemWave provider, you go to is a group training, and
Yes.
it's an environment where you get to be around your peers, other medical professionals. It could be, like I said, MDs, PTs, chiros, whatever, and everybody learns hands-on with the device. Where was your group training?
Was in Pittsburgh with Dr. T.
Cool. What was your experience at the group training compared to like what you imagined training with StemWave would be like?
Oh, I thought it was great. I I did notice there was, a wide variety of other providers there with us. We had some athletic trainers, we had a couple of primary care medical doctors who brought their whole staff. There was a fair number of chiropractors there as well.
Yeah, that's a kind of a good point too to touch on is that you can actually have your staff trained on StemWave. It doesn't
hmm
fall all on the actual provider who runs the clinic. It's a great way for providers who have a lot of cases coming through to be able to offload some of these treatments on their staff, as long as obviously they're involved in the treatments and monitoring the patients and all that kind of stuff. So I say this a lot on these Q&As when we talk about group training because it's one of my favorite things. I've been fortunate enough to go to a handful of group trainings, and one of my favorite things is seeing when like medical professionals are still a little like leery of if this is legit or not, like if this thing actually does what it says it's going to do. And then in these hands-on group trainings, a lot of times the providers get treated by the clinical advisor from StemWave, or they do it on each other. And then they have these like epiphany moments of, oh my gosh, I've had this shoulder issue since I was in high school, and now it like doesn't hurt anymore. Do you remember if anyone at your group training got treated and was just like, oh, this is actually really good?
Yes, there was a physical therapist at my training who got his knee treated, and it, kind of a chronic issue. He'd had surgeries, he had injections, he'd had all this stuff. And Dr. T treated it, and he, immediately had significant improvement in his squat depth and level of pain. And even as he was leaving at the end of the day, he was just had that kind of wow look on
Yeah.
his. That's what he kept saying was wow, like
That
I
never
haven't
gets
felt this
old.
good in,
Yeah.
yeah, no.
And especially like obviously like we'll talk about patients and stuff in a bit, but like for medical professionals to like have that wow themselves, that's always so special. We actually last weekend, StemWave was at a national peptide conference in Las Vegas, and we had our device out there with some of our clinical advisors, and there was a medical professional that came by the booth, and she got treated for the first time, and she had been in pain pretty much like her whole adult life. And that first treatment with StemWave at the convention got rid of so much pain that she started crying. Started crying right then and there in the booth. And yeah, it was like life changing for her in that moment. So much so that she said, I need one. I want one. So I love hearing all those stories of the medical providers getting treatment themselves. So after your group training, you felt like, okay, I know how to use this thing. Now, did you get the device before your training, or did you get trained first and then the device?
I did. We got the device at like the end of October, and then the first training that was available that I could get to was in December.
Okay, so
So we
you had
actually,
a couple months or like a month
yes,
and a half
yes. So we were,
playing.
experimenting,
Yeah.
playing around with it in our office. And actually, I had a shoulder injury myself. So I was the first person that we treated was for my shoulder problem, which had been bothering me since we moved to Florida. I had to move my husband and kids down here first because school was starting, and then I stayed behind in Oregon and continued to run the practice while we were transitioning to the new buyers. So my patient volume immediately doubled, and I moved, and I had all this other stuff. And so I really hurt my shoulder, and it had been bothering me every day. I couldn't sleep on that side. It was miserable. So like as soon as we opened the box and set it all up, we put it on my shoulder and we kind of mapped through and followed what the video said and found those areas that I got the feedback from the device and immediately I could get my arm over my head again and it was amazing. So
Yeah.
it only took a couple visits for me to really get it feeling really great and back to all my activities. So that also sold me.
Yeah, I think that's a good thing to note. You got your device before your group training, so people may be like, "Well, if I get my device, how am I going to know how to use it?" And you just said it. We have instructional videos. We have very comprehensive instructional videos of not only like how to do all the protocols for any body part, but also how to set up your device. How was your setup process for people that don't know?
Oh, it was pretty simple. The device comes in a big crate, and then you have to have a screwdriver and a drill to get the box apart, and it's all set up. So you just kind of hook up the different parts and put the saline solution in the head, and then I'm pretty sure someone from the tech support department was on a Zoom call with me, and we went through, making sure that everything worked, and
Yeah,
um, they set
that's
my concerns at ease.
it's also a good thing to touch on is that we do have a lot of video references. We have a lot of support when it comes to instructions and things you can watch and read. But when you become a StemWave provider, it's like you join the StemWave family. We have, our IT department, our customer support. We're all there ready to help if you have any questions. Like you mentioned, it's one phone call away and we'll walk you through it. We got videos, we can do, virtual calls, all that kind of stuff. So you're up and running, you did your group training, you got all the videos, everything's going well. Do you remember when you first had your first StemWave patient?
Um, yes, for sure. We kind of opened it up to our current patients, uh, and then the first few were thrilled with their treatment. So we had one that was a hip, we had one that was a shoulder, and we had a like a chronic low back pelvis issue. And these people, um, our community is relatively affluent, and we do have a lot of like retired athletes. So these were actual like retired professional athletes who had beat themselves up and want to continue to play and not the same sport that they retired from, but they want to continue to,
Put me
be
back in, coach. I'm ready
competitive
to go.
in
Yeah.
competitive in golf or whatever. So they had a great experience. Immediately were referring in their family and friends. It was very eye-opening.
And that's kind of cool too to be able to have former professional athletes because those people have seen almost every type of
Yes.
modality. And so
Hmm.
when you have someone like that, or even a regular person,
Right.
how do you explain what this treatment's going to be like and what it's going to do for them when they've never heard of stem wave, shockwave, anything like that?
Um, so I feel pretty confident and comfortable explaining kind of how the device is supposed to work, how those acoustic waves are triggering different physiological responses in the body. And so my patients tend to be into that too. So they were, already doing all of their own research. They're going out and they're getting PRP injections. They're doing all this stuff. They're looking into, flying overseas for stem cells. So they like the idea of not having to travel so far, and uh, and doing a little biohacking kind of thing. So my husband has kind of a different client base who maybe aren't quite uh, as passionate, a little more average. And so he tends to explain things a little bit on a more simpler basis to them, but really just we just tell them like, hey, you want to give this device a test drive? Let's see. We've been treating you for a while and we're kind of plateauing. I really think we can kind of take things to the next level for you, and we're gonna let's just let, it's the test drive that we call it, and that initial mapping session and kind of like a little mini treatment, and they feel an immediate response. That that's what sells them more than anything that we say.
Mhm. Yeah, I think that's also the reason why we have a lot of providers that do like a low cost introductory treatment because
Mhm.
they know if you can just get somebody to feel their first treatment, they'll be sold.
Right.
Just like that provider we were talking about in your group training, like you have a chronic injury and then you get one treatment and you have better range of motion and you're like, well, I want more of this.
Right.
Um, I love hearing providers talk about these wow moments.
Mhm.
Do you remember any wow moments with your patients after they got their STEM wave? Or maybe it took a few uh, sessions with STEM wave, but I've personally talked to a lot of patients. We have this YouTube series we do called the Impact series where I get to sit down with patients and we have this almost like Netflix documentary interview style video. And I hear all the time these crazy stories about either they had an MRI for a tear, or there was a break or something that needed surgery or intervention from a surgeon in some way, whether it was injections or surgery, and then they did stem wave instead. And then when they came back, X amount of time later, the doctor's like, where's the problem? It's gone away. Do you have any stories like that?
Yes. An advantage that we have here in Naples is a lot of our people are snowbirds. So, they kind of start treatment somewhere else and then they come down here and they're going to be here for 3 or 4 months, and we get a chance to work with them then, and then they're going to go back. So just this past winter, I had a woman who she'd been dealing with a really severe um, hip issue. She knew she had a labral tear. She had trochanteric bursitis. Her surgeon in wherever she was from up north, somewhere in the Midwest, had already scheduled her for her surgery in May before she came down. So she was like, I want to enjoy my time in Florida, and I don't want to spend the entire time recovering from surgery. So she had it scheduled. And she came down, and we do use that done with you social media marketing with in partnership with StemWave. So she came in from that, and we started treating her hip, as she had immediate improvement in pain intensity. But she kept on telling me, I have surgery scheduled in May. So I'm going to keep that appointment on the schedule. And I was like, that's fine. But let's just try this. So we went through a full course of about 10 treatments over about 2.5 months. And then she asked me to uh, order another MRI because she was feeling so good. Um, so we did that MRI, and she actually was driving back up north, and she called me while she was driving, and she said, I am so excited. I am calling my surgeon next, but I'm calling you first because I just got the results of the MRI and the tear is gone. And I was like, okay, I really wasn't expecting that. um, that to actually show up on imaging that that tear was gone. So she canceled her appointment. She didn't need surgery. She was absolutely thrilled. She left us a great review.
I'll say.
Yeah.
I mean, how does it make you feel to know that you can give somebody the ability to avoid surgery with STEM wave?
I think it's really incredible. I like that's my ultimate goal for people is, to heal and really to not need to come back and see anybody for their problem anymore. She doesn't have to continue with injections. She doesn't have to continue with anything. We'll see when she comes back down next winter if there's anything else that I need to do for her. But yeah, she's doing amazing.
This is so important. This is so important to talk about. I'm so glad you have that story. And I want anybody who's listening to this to realize, like, as a medical provider, like your primary goal is to heal your patients. And I know it sucks when you have to refer them out to somebody else that, you can't provide what they need, whether it's a tear where you can't, do the surgery or whatever. And you probably wish there was a way that they didn't have to go through that invasive step. And now there's this non-invasive tool that can heal somebody and have them prevent surgery. And you're now being looked at by these people as this like amazing sorcerer that can magically
Right.
heal things that were never possible before with something like this. That's
Right.
so important. I mean, that's really, we talk about this all the time at StemWave. The reason why we exist as a company. Yes, we have an awesome device. Yes, it works. But more importantly, we are trying to change traditional healthcare. If somebody has some sort of acute injury or chronic thing going on, chronic pain, in the past, it's always been, we'll prescribe them painkillers or injections, cortisone, or, oh, you're going to need a knee replacement or hip replacement. And we can now start changing that. I mean, you have a perfect example of that with your own case. And it means the world to us that we can play our part in changing this healthcare system and getting people healed naturally with their body's own healing with the help of some really powerful sound waves. So that's fantastic. I love that story, and I love you were able to do that for her. You did touch on something which I think that is important to talk about, the Done With You program
Mhm.
at StemWave. So I mentioned before that, there's a lot of support here at StemWave for our providers. People that may have bought medical devices from other companies in the past may have experienced what typically happens where you buy the device and then you don't hear from the company again and they just drop it off and then you have to figure it out yourself, figure out how to market it, all that kind of stuff. It's different here at StemWave. We really want our providers to be successful. So we have this other side of the company, the Done With You side, and that is a team of people here at StemWave that work with you to give you the best results in marketing that your clinic has StemWave, get new patients in the door, help you figure out how to do ads with StemWave. Can you talk a little bit about your experience with the Done With You side?
Sure. Yes. So we are I guess it's now called the Platinum Providers level, so that the Done With You program is part of it. And they helped us set up our Meta account. They have access to it to kind of help us with getting the ads running and making sure that we're able to follow up on the leads and that we've got our uh, all of our settings correctly to make sure that we're utilizing our ad dollars as effectively as possible. And they've been really great and really helpful. For us for that. It's something that we have a hard time with in where we are in Florida because it is so transient. There's a lot of people who are in and out. And when we worked with some other people with the same system with using the high level, go high level lead funnel thing, where they were not nearly as helpful or they
Effective.
just didn't care. So it was very expensive with the previous people that we worked with for really middling results, not great. We were constantly getting people who'd respond to our ads, and they didn't live here. Like they lived on the other coast. They weren't going to come 2 hours for an appointment with me and then have to do that repeatedly. So they really were so great at helping us with some of the issues that we were having, so that the leads that we were generating were actual viable leads and people who could actually come into the clinic and kind of go through a full case if that's what they needed.
Yeah, that's awesome. That's something that I think a lot of providers are worried about when, especially bringing on a new device, is how do I market this correctly? I want to make sure that I get a return on my investment, all that kind of stuff.
Mhm.
So it sounds like you had really good results with our Done With You side, and I think it's important to note too. Not only do we have this Done With You program for like your ads and that kind of stuff, but we also provide our StemWave providers with a bunch of different like printed market material. There's like
Mhm.
trifold brochures. There's roll up banners that you could put in your clinic in your front rooms. There's like counter cards. There's business. There's all different things that we provide that can help you promote that you have StemWave. And we have these like great offer boards you can print out. I don't know if you've utilized
Yeah, we
those.
did that,
Okay.
which
Did
was
that,
great. People jumped on them.
yeah. So we're always
Offer a
we're always
discount.
coming up. Yeah, we're always coming up with new things to provide to help. We're always asking our providers what they may need or may want. Some providers take out newspaper ads, magazine ads, and we help design those as well. So we really are very involved in ensuring the success of the providers. And along those same lines, one of the other things that you may notice when you become a StemWay provider is you are assigned a dedicated client success manager who
Mhm.
walks you through onboarding and kind of holds your hand through the whole process and gets you on board. What was your experience like with your client success manager?
My client success manager is Sydney. She's been around for a while and she is absolutely amazing. Um, she checked in with me a little bit more when we were first launching, but she still does kind of like, hey, just want to check in, make sure everything's going well. And we did have an issue with one of our heads, I think, or one of the electrodes. We had like a faulty device, and she connected me with the right people. It was immediately replaced. There was, you know, it it was really just uh, great to see.
Yeah, we pride ourselves on being on top of it, and you're absolutely
Mhm.
right. Sydney is fantastic. Sydney is so fantastic that she is now the director of client success. So you started out with her when she
Mhm.
probably was first getting involved, and now she's reached director level and is
Mhm.
building that team in her image, and it's fantastic. So anybody who becomes a StemWave provider can rest assured you're going to have a fantastic client success manager because Sydney is making sure that that is handled properly and handled
Mhm.
very well. Um, I want to turn it over. If anybody who's joined us has any questions for Dr. McCabe about her StemWave experience, her practice, anything about her, or has general questions about StemWave, go ahead, throw it in the chat now. We will make our way around to it. I have some other questions too, but I want to open it up now just so people have time to throw any questions they have out there. There is one question that was posted about 15 minutes ago when you were talking about, I guess, your shoulder injury that you started using StemWave on when you first got the device. What was the diagnosis for your shoulder, if you got one?
Well, I didn't get any imaging on my shoulder, but I am pretty sure that I'm a very flexible person. So I grew up in dance and gymnastics, and so I think there's probably like a chronic labral tear in there.
Yeah. Do you remember what it was from? Was it moving?
Yeah, yeah, I think it was more from, moving. I was lifting a lot of heavy boxes. I went from adjusting, maybe 60 patients a week to adjusting 175 patients a week. So I was more of an overuse
Yeah.
trigger. I used to work out with a personal trainer, so I did a lot of heavy lifting for 15 years. So kind of who knows? There's the whole lot of options that could have really set off my shoulder, but
Yeah. You just said something that just reminded me a great thing to discuss, especially with, someone with your background who was doing manual therapy. It's hard on your body, especially if you're
Mhm.
seeing that many patients. Talk a little bit about bringing StemWave in with how quick treatments are and how you can kind of save your body from the wear and tear of doing manual adjustments and that kind of stuff.
Yeah, absolutely. So, uh, when we're working on a hip or a knee or an ankle, and we're going to do a manual therapy treatment, we're usually looking at 15-20 minutes of aggressively going after something, and it does add up on your hands, um, and shoulders and everything else. And the stem wave can treat the same area in 3 or 4 minutes, and I don't have to, put all my weight into my thumbs or whatever else. So it's been great.
Yeah, we actually have some providers that are older providers. They've had their practice for like 40 years or whatever, and they love STEM Wave because it prolongs their career.
Hmm.
They were starting to feel like I don't think my body can hold up if I continue with just manual therapy. And now with STEM Wave, they're like, oh, I can. Not only is this beneficial financially for my clinic, but I'm going to be able to extend my career, my practice much longer. So that's like
Yeah,
always been pretty
absolutely.
cool. Yeah. So you mentioned you were doing heavy lifting. We talked a little bit before we
Mhm.
hopped on live that we both have something in common. We both have done CrossFit extensively.
Mhm.
Do you have any like CrossFit type athletes coming in for treatment? Like what kind of things has StemWave been able to do with someone who's putting their body through the ringer on a daily basis?
Yeah, absolutely. CrossFit athletes do not want to be out of their sport for very long if they can avoid it. So we do actually, the owner of the gym that I go to jumped down off the box and broke her ankle.
Oof.
Yeah. She just landed funny, and so they have their own, people renting space in their office. So they were working with them and doing dry needling and laser and all the things, and it just wasn't healing. So I was like, well, we have this other thing at our office. Maybe, just come and try it. I don't want to take anything away from the people that you have this personal relationship with, and I know you refer back and forth to them, but maybe just come try it. So she did. She came and we fixed her ankle. So she's referred a few more people over to us, but that's what CrossFit athletes love is that there's no downtime after a stem wave treatment. They don't have to come out of their sport. She was out because it was a broken ankle, and it wasn't really healing very well. So, but we were able to get her back to um, being able to walk and
Yeah.
being able to get back to participating at a high level much quicker.
Yeah, I mean, even like a CrossFit athlete, even if they have a broken ankle, they're just going to do everything on their hands. They're just going to
Uh-huh.
walk on
Yeah,
their
that was
hands. They're
much
going to do
easier.
handstand pushes. They're going to do all that stuff. Yeah, you can't. I remember years ago, when I was like heavily into CrossFit, I tore my ACL and
Mhm.
I just got really strong upper body. I was just
Mhm.
doing everything on the barbell and the rig and stuff like that. So can't keep a good CrossFitter down. But man, if they had stem wave back when I was doing competitive, that would have been a game changer. I can only imagine that now, especially like with your community of CrossFit that you have there, they must love you.
Yeah, it's pretty awesome.
That's so great. So, what are some of the cases that you've seen? I mean, you mentioned a broken ankle, and a
Mhm.
lot of people, who are still kind of learning about stem wave and all the capabilities, um, are surprised at some of the things that it's actually able to heal, along with like soft tissue. And now we've talked
Mhm.
about bone as well. Have there been any cases that have come through that you thought, like, I don't think this is going to work, and then
Mhm.
it did?
Yes. So, we, uh, I tend to, because I'm just so curious about different things, I tend to get some really unusual cases. So we had a woman who had she had surgery, and she developed a seroma, which is like a pocket of fluid, and it had gotten really hard. She'd been going to a lymphatic drainage specialist. They couldn't do anything for her. The it and she was really depressed about it, actually. It was kind of disfiguring, and she just was really upset that this had happened after her surgery. So we treated that, and that took a little bit more treatment. And I just told her, like, I'm not sure what sort of results we're really going to get, but we did resolve that seroma for her. And so she was thrilled, and she went back to her surgeon and told her surgeon, send everybody to Dr. McCabe. And I was like, I don't want it. I don't know. But so she's, kind of developed a little professional partnership for me with this surgeon if things look unusual, they'll send them to me. We've also had a couple of cases of some peripheral neuropathy that we've treated, where they've regained the normal feeling in their feet so that they can wear shoes. They weren't wearing shoes anymore because their feet always felt like they were on fire. So we were able to treat that. It was very interesting case. Even the tissue of the skin, like and vasculature, their feet returned to looking normal. It was really kind of cool.
It's kind of cool that you have that surgeon that like sends you all of the strange cases that it's almost like that TV show House. You're like
I
Dr.
know.
House solving medical mysteries with StemWave. That's a
Yeah.
good show. I would watch that show. Um, yeah, it's always surprising to see like really like what StemWave can tackle, and there's really like not a lot that it can't do. You mentioned the nerve stuff. We actually partnered with this clinic called Project Walk in Boston, and
Mhm.
it's strictly spinal cord injury patients. So, quadriplegics, paraplegics. And we actually did one of our very first Impact Series video with them. And we got an update. It's been about a year. We got an update recently. We're gonna actually like do this properly, probably with a video or an article or something. But you know, just throwing it out there, the quick update is that all of their patients that have been in the StemWave protocol, we've gotten them off their pain pills from their injury sites. They were taking some pretty heavy duty pain pills to, be able to function on a daily basis,
Mhm.
without being in pain. And now they don't have to take them anymore. And that's one of the things that we strive to do as a company is to, like I said, change traditional healthcare and to get people off of pain pills. We know how bad that is. So it's pretty cool that it does regenerate the nerves and like you said, in your patient, it can make a foot look like it should and get feeling back in it. And I'm always amazed at that kind of stuff. It's just one of those feel good things that oh yeah, we're doing the right thing here.
Mhm.
We just got a question in the chat. I think this is referring to that CrossFit athlete with the broken ankle. What was fractured? How long post injury did you see her? And was she immobilized initially?
She was immobilized initially. She had a talar dome fracture. So it was an intra-articular fracture. And I didn't start seeing her until probably maybe a month after it happened. And because she was originally misdiagnosed as an ankle sprain. So she didn't know that there was anything broken in there. Originally, it didn't show up on the plain film x-ray. They did a MRI because it wasn't healing the way that they were expecting, and then they could see a little bit better. So I saw her. I think I saw her about 4 times over the course of a couple of months.
Awesome. Yeah, and just on the topic of athletes, if any of our providers that are watching deal with athletes, whether it's like student athletes or even professional athletes, it's kind of cool to know that we've partnered with a bunch of Division I colleges through athletic programs. A lot of these colleges, like University of Alabama, Maryland, they're using StemWave now on their teams. And we're in the NFL, the Washington Commanders use StemWave, and I actually did one of these live Q&As with their lead trainer, Mark McCracken. And at the end of the season last year, he said that they went from one of the highest teams in the league injury rate to last season the lowest team injury rate. So it's a great preventative tool as well, like for all those like bumps and bruises and things that are just
Hmm.
bothering players. I'm sure you've seen some of that too with your pickleballers. Like if you can get them in on some sort of maintenance routine, it prevents the
Hmm.
bigger injuries.
Yes. They're big fans of you coming in for just a couple minutes and then not having to stop playing. They play for hours,
Yeah.
you know.
Guilty.
Right?
Guilty
Yes.
too. Yeah. Yeah. You just said like come in for a couple minutes. We've gotten questions in the past on these things for people new to StemWave. How long is a treatment? How long does a treatment take to perform?
Well, it depends on how large of an area it is that you're working on, or if you're doing more than one body area. But usually, a treatment is like 3 or 4 minutes.
So
It's
fast.
very quick.
Yeah.
Hmm.
And that's why, one of the things we promote is you're able to see more patients, but
Hmm.
not spend the, 20, 30, 45 minutes with them, but get results like you spent the whole day with them, working
Right.
on them, right? It's like a win-win for everyone. Um, when you first got your STEM wave and you were talking to our sales team, I'm sure they told you all about our 60-day trial. We'll
Hmm.
put STEM wave in your practice. You can try it for 60 days. If you don't like it or it's not working for you, take it back. You don't have to pay for it. But clearly, you were successful in your first 60 days.
Hmm.
Maybe you can share with people what your first 60 days was like, from obviously the STEM wave was working with your patients, but also like from your return on the investment, how was it for you that you felt so comfortable to keep it?
Well, it immediately improved our cash flow of the clinic by, a minimum of about 5 grand a month, even, not pushing it really heavily and not running a lot of ads. We weren't, trying to blow the doors off of this place. We were just kind of incorporating it gently with the people that we thought were the best fit. And then we started doing more advertising to kind of pull that type of clientele in separate from our chiropractic. I don't know if everyone on this call is in chiropractic, but there's a lot of people out there who don't like chiropractors. So it was really great when we started running ads for the STEM wave that we started getting interest from people who wouldn't have normally sought us out as chiropractors. They're seeking us out for this regenerative treatment. And it's kind of opened up some other avenues, and obviously connected me with the surgery center. It's connected me with a lot of other um, uh, pathways for patients to find us. So it immediately improved our patient volume and our collections. So we've consistently covered our overhead and the cost for uh, our payments towards purchasing the device and everything. It was kind of a no-brainer to
That's,
keep.
that's yeah, that's awesome. And that's such a cool thing that, I don't think we talk about enough. Whatever stigma there is out there with some people and chiropractors, Stemway gives you an opening to allow these patients to come in with a
Mhm.
different mindset. It's a regenerative therapy. It's not like a traditional chiropractor adjusting or whatever.
Correct.
And I've heard personally a lot of our providers talk about, especially when they first found out about StemWave, like the reason why they wanted StemWave or something like StemWave was they wanted like an edge. They wanted to get like an edge. They wanted to have something that, not a lot of other providers out there would have, would give them again the
Mhm.
money where they're the edge and that word regenerative. That's like a
Mhm.
big word right now. Like people want to be able to stay young, feel healthy,
Right.
regenerate, all that kind of stuff. So I think that's a great point to make about some an edge again that STEM wave would
Mhm.
give a chiropractor, especially, but any medical professional really.
Mhm.
Um, every, you know, there's always new stuff popping up every day. You see it on your social media feed. So this is like another great way to feel current, feel on the
Mhm.
cutting edge, feel like you have something that is new and refreshing. And, honestly, it just works really well. So I'm really glad to hear that it worked for you so well, especially in that first 60 days, because I know that's what makes people the most nervous is, will this work for me right away? And
Mhm.
the answer is most likely, yeah. We do have a 98% success rate, and that's for a bunch of reasons. A few of them are that number one, we know what we're doing. Number two, we've been over this through this call about how much support we give our providers with our team. This exceptional team here. And number three is that it works. It works really, really well. Um, we also have, along the lines of the support, we have this platform that we use. It's called School. It's this website where all of the instructional videos live. There's a message board where providers post their wins. So if they had, like, Dr. McCabe might post that crazy thing with the ankle, had a
Mhm.
athlete come in and she had a broken ankle. And so other providers can, much like we're doing on this call, hear stories about how people are using StemWave successfully. And then we have live coaching calls. Everything also gets recorded in case you missed. Have you been involved in the community side of StemWave as well with like coaching calls and all that kind of stuff?
Yeah, I would say definitely I was more involved in that stuff when it was newer to me. I've gotten a little just busier, and so I haven't been on those calls as much of late. But I do still go into the school community a fair amount because we are, kind of a resort or destination community. People are down here for part of the year and then they're going back up north. Actually, that school community has been great for me because people will post in there that they're looking for a provider somewhere. Like, I'm looking for someone in Naples, Florida. And so some of my very early people who we had really good success with were referrals from other states and other providers where they maybe had started their stem wave treatment and then we were continuing it for them down here or vice versa. Um, so the school community is awesome. And there's a lot of good people who are using the stem wave. So I like learning from them too.
Yeah, and it's cool. I mean, just having a community is such a benefit. And much like CrossFit, it's a community.
Mhm.
There's like-minded people. Everyone has the same goal, which is to get their patients better in a non-invasive way. And it's really cool to hear and see all those success stories and sometimes those wild ones. Like,
Mhm.
the patient came in with frozen shoulder for 40 plus years, and after one treatment, he's doing windmills, like
Mhm.
those are all really great. So we're going to be wrapping up. If anybody has any questions left for Dr. McCabe, throw them in the chat now. I will kind of finish up with one of my favorite questions, which is, what is one thing that surprised you about StemWave? Something that you didn't expect?
I just really appreciated all of the support, like all the people that are part of StemWave. Like I really felt very confident that this, incorporating Shockwave was the right thing for our clinic. Our clinic name is Innovative Pain and Performance, so we are like it fits right in with kind of the the type of devices that we want to use, the type of care that we want to provide. So it wasn't so much about the device as much as kind of the whole community and kind of the whole experience of launching this new treatment in our office was uh, um, really felt like there were a lot of people behind us and a lot of people who were rooting for us to be successful and were involved in getting that for us. And it wasn't just the people who work for StemWave, but also the other providers who use it. I just thought that was a really cool experience.
It's a great answer. Yeah, I mean, we pride ourselves on that. We're all in this together. Without our providers, we wouldn't have anything. Without us, you guys wouldn't be able to treat the way you are. So it's great synergy.
Mhm.
So wrap this up right now. I just want to let everyone know, if you guys have been listening, Dr. McCabe has some incredible results using StemWave. It's been great for her business. It's been great for her patients. If anybody on this call is interested in bringing in a non-invasive regenerative therapy, bring in the StemWave to your clinic. Again, we offer 60 days. We'll put it in your clinic. You could try it out. If it doesn't work for you, if you don't like it, you can send it back. You don't have to pay a thing, but you're probably going to love it, just like Dr. McCabe did. We have a 98% success rate for a reason. I talked about it, and I'm going to throw in the chat right now. StemWave.com is our website. Click on it, check it out. You can book a call with our sales team, and you'll have a conversation kind of like Dr. McCabe and I just had right now, where they're going to find out about your clinic, find out about the type of patients and things that you see every day. Make sure that StemWave is a good fit because we don't work with everybody. We want to make sure it's a good fit. And if it is, you're going to see some really amazing results with your patients. You're going to see your collections go up, just like Dr. McCabe mentioned. Um, right before we sign off, we have a new question that just popped in. We can answer really quickly. So, do you typically sell packages of 4 to 5 sessions or one session of StemWave? How do you kind of package up your treatment plans?
So we do packages of 10, like we do a case fee, which is what Dr. T kind of talked about. So usually that's 10 sessions to get a discount. And then we do have some people who choose to kind of pay as they go, and then if they pay our full price. Um, so I guess we kind of have both options available. We really make it so low pressure on our patients, and almost all of them will choose to do a series of treatments. But some people in particular, as I've mentioned over and over, where we are, there's just a lot of people who are in and out. Um, so those people may only be seen 2 or 3 times because they're only here for a month. And so that's why we have kind of other options available, but it's normally a about 10 sessions.
Yeah, and we touched on this earlier too. I think it's good to mention um, having someone be able to get that first treatment at a very affordable price
Mhm.
opens up this possibility of adding on the 8, 10, 12 treatment
Right.
bundles because when someone is in like severe pain, like chronic pain, and
Mhm.
they've found no solution and their only options are like surgery or living with the pain or whatever it is, and there's no guarantees on any of that stuff. And they do that first treatment and they feel their pain go away, they almost kiss you on the mouth. Like they're so happy to sign up for whatever is going to keep that pain away. So it's
Yes,
really
we've
amazing.
definitely had people offer to marry me,
Yeah.
but I'm already married, so
Yeah, I mean it's really like you I've seen it in person myself. The emotion that comes through when somebody's
Mhm.
pain that's been there their whole life and they've resigned themselves to this is just how life is going to be for me for the rest of my life. And then all of a sudden you're able to remove that pain. And
Mhm.
um, I like to say like StemWave doesn't just heal people, it gives them their life back. And
Yes,
that's what you're doing.
I agree.
Awesome. Well, that's a great part to end on, I think. Very poetic. Um, All right, we got one more question. We have 1 more minute. So, just real quick, any indications for stem wave therapy? There's a bunch of medical terms that I'm not going to try to pronounce, but I'll let you do it.
Okay. Arthralgia, low back pain. Yes, we use it for different spinal conditions. We use it for pelvic pain, bursitis, frozen shoulder, um, Osgood Schlatter's for
Hmm.
our student athletes, and Seaver's disease. We see a lot of soccer players. So that's an issue at the ankle. So yes, I would say those would all be indications for
Yeah, there's not much I can't do. We know that.
no.
Awesome. Well, all right, we're going to wrap it up now. Again, check out stemwave.com if you're interested. Talk, chat with our team. Dr. McCabe, it was an absolute pleasure talking with you today. We are so fortunate to have a stellar provider like you administering StemWave and giving people their life back. So thank you so much.
Thank you.
All right, we'll talk to you later.
All
Bye.
righty, thanks so much. Bye bye.